Pulse oximetry is a painless and non-invasive way to measure the oxygen saturation of the blood. It provides information on the patient's heart and lungs and the amount of oxygen that is being delivered to the tissues of the body. The pulse oximeter is a computerized device consisting of a monitor and a probe that is clipped to the patient's finger. The probe senses the oxygen saturation in peripheral capillaries, which is abbreviated as SpO2. The oxygen saturation level of most healthy individuals falls between 95 to 99%. A level below 70% is life-threatening. The pulse oximeter also measures the patient's pulse rate in beats per minute. Sanitize your hands before beginning the procedure. Assemble your equipment. You will need a pulse oximeter and probe and an antiseptic wipe. Handle the probe carefully and check to make sure it opens and closes smoothly. The probe needs to be clean and free of dirt and lint to provide an accurate reading and to prevent cross-contamination between patients. Disinfect the probe windows and surrounding platforms with an antiseptic wipe and allow them to dry. If your model requires it, connect the probe to the cable. As you can see with this model, the probe is permanently attached to the cable. Plug the cable into the port on the monitor. Do not lift or carry the monitor by the cable. This can damage the connections. Greet the patient and introduce yourself.
Hi, my name is Kim, and I'm going to be your medical assistant today. How are you doing?
I'm good.
Identify the patient and explain what you plan to do.
Okay, Caitlin, I understand you had some wheezing problems last night. Okay, I'm going to need to take your oxygen level. Have you ever had that done before?
No.
Okay, it doesn't hurt. All we do is we put the clip and we take it and put it on your finger.
The patient should be seated comfortably with the lower arm firmly supported to prevent the patient from moving her hand, which could cause an inaccurate reading. Position the hand with the palm facing down. Select an appropriate finger to apply the probe. The highly vascular tips of the patient's index, middle, and ring fingers are good sites to use. Several factors can alter or interfere with the measurement. Check to see if these exist and take action to correct them, or choose another site to attach the probe, such as the toe or earlobe. If the patient's fingers are very small or very large, the probe may not align properly. If this occurs, use the earlobe to take the measurement. Observe the patient's fingernail. If the patient is wearing dark fingernail polish, ask her to remove it with a nail polish remover. If the patient is wearing artificial fingernails, choose another probe site, such as the toe or earlobe. Check to make sure the patient's fingertip is clean. If it is dirty, cleanse the site with soap and water and allow it to dry. Make sure the patient's finger is not cold. If it is, ask the patient to rub her hands together. Make sure that a light source is not shining on the patient's hand. If it is, remove the light source. Move the probe away from the light source, or cover the probe with a washcloth while performing the procedure. Position the probe securely on the patient's fingertip. Make sure the fleshy tip of the finger covers the LED window. The tip of the finger should touch the end of the probe stop. Place the cable so that it lays across the back of the hand and parallel to the arm. Instruct the patient to remain still and breathe normally to ensure an accurate reading. Press the on-off control to turn on the oximeter. Wait until it goes through its power-on self-test. If the monitor fails the test, troubleshoot the problem by checking the error code with the instruction manual and taking the recommended action. Allow several seconds for the oximeter to detect the pulse and calculate the oxygen saturation. Look to see that the pulse strength indicator is fluctuating with each pulse beat and that the signal is strong. The oximeter will sound an alarm if it cannot detect a pulse. If this occurs, reposition the probe or move it to another finger and try again. Leave the probe in place until the oximeter displays the oxygen saturation and pulse rate. Caitlin's oxygen saturation level is 97% and her pulse rate is 100 beats per minute. Make a mental note of these readings. If the oxygen saturation is below 95%, there might be a problem with the placement of the probe. Reposition the probe on the finger and try again. Remove the probe from the patient's finger. and turn off the oximeter. Sanitize your hands and chart your results. Include the date, the time, the oxygen saturation reading, and the pulse rate. Disinfect the probe with an antiseptic wipe. Properly store the monitor in a clean, dry area.